Hi guys. Today I want to take a look at one of the most important tools we have at our disposal in the fight against an infectious disease, and that's the vaccine. Now, in a previous video, we took a look at the way that antibiotics can be used to treat bacterial or fungal infections. Antibiotics kill off a living pathogen and give our immune system a chance to function to overcome a disease. However, with a viral pathogen, antibiotics simply aren't effective. You can't take an antibiotic to overcome the common cold or a flu or a coronavirus. Antibiotics won't work. And though antiviral drugs do exist, they have severe limitations. Antiviral drugs typically focus on blocking the replication or docking of a virus with the host cell. Though this can be effective in shortening the duration of an infection or reducing the severity of that viral infection, typically antiviral drugs need to be taken every single day for the remainder of the infection. And with a long-lasting persistent virus such as HIV, that could mean taking an expensive medication on a fixed schedule for the rest of your life. Now, this is one of the reasons that things like HIV have so much more impact in underserved communities than they do in affluent ones. If you don't have good access to medical facilities and care, and you don't have the money to be able to spend on a drug treatment that's going to last for your entire life, you may be at much greater risk to suffering from HIV or other similar infections than if you're in a more affluent community. Now, for this reason, vaccines are particularly important in our fight against virally caused diseases. Vaccines are a different approach. Vaccines attempt to harness your own immune system in order to fight off a pathogen. What a vaccine is an introduction of specific antigens from a pathogen. Oftentimes these vaccines are produced by weakened or killed pathogens, but sometimes they can be produced by a less lethal form of a particular pathogen. Once those antigens are introduced into your own body, what the vaccine's purpose is to activate the cells in your immune system that recognize that particular antigen. Now remember, antigens are small molecules that cover the surface of a pathogen. Your immune system has cells circulating all the time, B cells and T cells, to recognize any particular antigen that might be introduced into your body. If you introduce the antigen associated with a particular pathogen, the B cells and T cells that recognize that antigen are going to multiply. They're going to go through clonal selection, and we're going to produce a trove of cells that are designed specifically to fight off that pathogen if we encounter it in the future. So the hope is that your own body will be able to fight off that pathogen without even developing signs of the infection. Now, in our bodies, we at all times have, like I said, many different kinds of B cells and T cells. Ones with B cell receptors and T cell receptors to recognize a whole host of antigens that we may have never seen and that we may never see. So there are different shaped B cells and T cell receptors to recognize different antigens circulating all the time in your body. What a vaccine does is to introduce a large number of the antigens associated with a particular pathogen. Now in this case, you can see that cell number 1, the cell shown in blue, its B cell receptor on the cell surface recognizes that particular antigen. And that triggers, along with the help of a helper T cell, it triggers clonal selection of that particular cell. So we get a huge clone of what we call effector cells. The effector cells, shown on the left, are active plasma cells that produce antibodies within the body. Those can fight off an infection if you have it right now. Those antibodies are going to be effective, and those effector cells tend to last for about a month in your bloodstream. But at the same time, we also produce a clone of what we call memory cells. These memory cells are longer lived. The memory cells can then respond to a future infection much more rapidly. One of the things that's important to note is that normally a specific killer T cell or B cell would need the help of a helper T cell to undergo clonal selection. But these memory cells can generate a much faster immune response because they're largely freed from that requirement. They can, if they see a similar pathogen to which they're accustomed, they can immediately respond at a much faster level and undergo clonal selection much more strongly than a naive B cell. So for example, if we look in this graph, a naive immune response might be shown by the curve in blue. We see a relatively slow response to the introduction of an antigen because all of these cells are having to rely on helper T cells to go through clonal selection, so we get a relatively slow and relatively weak immune response. In contrast, an individual that's been pre-exposed, shown in red, has a stronger and faster immune response because of those memory cells that allow him or her to react incredibly quickly to the introduction of an antigen. What that stronger immune response means is that basically you're not even going to get sick. Now, a lot of people wonder why, when you get vaccinated, sometimes you have a slight reaction to that vaccine. And the reason is because you're injecting yourself with sometimes a weakened or killed form of the particular pathogen, your body's immune response, well, you notice it. You notice the things caused by that immune response. You might have soreness, you might have slight symptoms of the disease as your body fights against it, or as that weakened pathogen circulates in your bloodstream. But when you encounter the real disease, your immune response is going to be much stronger, and you're not going to develop the symptoms to the same extent that you would if you were a naive individual. Now that we've talked a little bit about the way that a vaccine works, I want to give you a couple of examples of vaccines that have been important in eliminating or largely eliminating diseases that have been incredibly dangerous in human history. The two cases that I want to look at in particular are polio and smallpox. Smallpox is one of the deadliest diseases in human history. It's a viral infection caused by the variola virus. Now, this virus leads to high fever and the formation of pustules throughout the body. Those pustules can burst, spreading the disease, and can, even if the person survives, scar over and leave permanent, serious, lasting deformities. Smallpox is lethal in up to a third of individuals who suffer from it. One of the first attempts to treat smallpox or to prevent smallpox came in the early 1700s in the Boston area in the United States. Dr. Zabdiel Boylston, who may be known to Boston residents because of Boylston Street, treated patients by giving them a tiny dose of the pus from a smallpox pustule. He would either introduce this to their skin or into their nose. Now, by giving patients this, he basically guaranteed that they would get smallpox. But typically, the infections that these patients had were not as severe as if they developed smallpox normally. And moreover, they were immune to smallpox in the future. This was particularly important because Boylston's treatments were influential in reducing the impact of a smallpox outbreak in the Boston area in the early 1700s. At the same time, Boylston's treatments were highly controversial. They provoked outrage that he would be willingly infecting people with the smallpox virus. And in fact, Boylston's family was attacked, and Boylston could only visit his patients at night and often in disguise. Now, Boylston's program was not, strictly speaking, a vaccination program. Boylston was treating patients with live virus and an unadulterated virus. In the later 1700s, Dr. Edward Jenner in England became what was truly a vaccination program. Jenner noticed that people who had been in contact with cowpox, a close relative of smallpox, seemed to be immune from smallpox during smallpox outbreaks. He therefore began giving people inoculations with cowpox in the hopes of giving them immunity to smallpox, and he published his work in 1801. Now, at some point in the 1800s, people switched from using the cowpox virus to the vaccinia virus in order to make the smallpox vaccine. And that vaccinia virus is where we get the name vaccine. Smallpox treatment programs were so effective that smallpox was actually eliminated in North America by 1952, and smallpox vaccinations were stopped in 1972 for American youth. Smallpox was eliminated worldwide by 1977, with the last recorded case occurring in Somalia. Now, smallpox today exists only in two laboratories, one in the United States and one in the Russian Federation. And the hope is that these viruses are kept alive for research purposes in case there is ever another smallpox outbreak. Unlike smallpox, polio has not been eliminated worldwide. Polio is a viral infection that attacks the body's nerve cells. By attacking nerve cells, it can lead to muscular weakness, even paralysis, trouble breathing, and possibly death. Moreover, even in individuals who don't die, polio can often lead to symptoms of persistent paralysis. And in fact, infection among youth with polio was a cause of paralysis of many, many individuals historically. Notably among them, President Franklin Delano Roosevelt, who suffered from polio as a youth and had permanent effects. Thanks to the work of Dr. Jonas Salk at the University of Pittsburgh and John Enders at Boston Children's Hospital, U.S. vaccination attempts against polio commenced in earnest in 1954 with wide-scale public trials. In fact, mandatory vaccinations for school children largely halted and eliminated polio within the U.S. These vaccines were initially administered in an injection using a form of the polio virus, and eventually were administered orally using a weakened form of the virus. This isn't to say that the vaccination programs were without flaws. In the early years in 1955, people recognized that some of the people who had been vaccinated were in fact coming down with polio-like symptoms, paralysis, and even death in some cases. Now, this was later attributed to a manufacturing defect in which many of the vaccinations involved viruses that had not been completely killed. One of the most important things to realize about a vaccination program is that they can be effective even if every single person in the world isn't vaccinated. Smallpox has been eliminated from the world, but I can guarantee you that not every person on the world was vaccinated against smallpox. And the reason for this is that vaccines enable us to develop what's called herd immunity. Now, imagine there's one individual who's infected with a particular contagion. Normally, they would spread this contagion to other individuals into which they'd come in contact. And this would go on and on and on until either the contagion had affected everyone or enough people had recovered from the contagion to have developed immunity. In the case of a vaccination, though, even if not every single person has been vaccinated, as long as a fair number have been, it will dramatically slow the spread of the contagion because the people that infected individual will come in contact with, well, many of them will have been vaccinated and will therefore have immunity. Unable to spread, the contagion won't be able to reach nearly as many people and will die out over time. This concept of herd immunity is what enables us to have effective vaccination programs even if not every single person is able to be vaccinated. This is particularly important because there are certain people, because of reduced immune systems, who may not be good candidates for vaccination. It's thanks to organized vaccine programs that we've been able to reduce or even eliminate some of the diseases that have been the scourge of humankind. From things like smallpox that eliminated and wiped out entire continents, to things like chickenpox, measles, mumps, rubella that were responsible for suffering and death among the nation's children. These sorts of things are largely a thing of the past because of organized vaccination. Now, it's true that vaccines aren't perfect. As we saw in the early case of polio vaccine, improperly made vaccines could be potentially dangerous. And it's important that vaccines be held to strict standards so that they don't end up propagating the diseases they're meant to prevent. In addition, some people aren't good candidates for vaccination because of a compromised immune system, because of age, or some other underlying health condition. Moreover, certain diseases aren't good candidates for vaccination because these diseases might mutate really rapidly. And so if you prepare your immune system to recognize an antigen that's on that pathogen this year, it might not be on that pathogen next year. And for this reason, vaccinations aren't perfect. But it's important to remember the effect that they've had. These have eliminated diseases that caused the death of vast numbers of people throughout human history. Willfully ignoring evidence about vaccines has caused Americans to reintroduce diseases that were nearly eliminated and is responsible for death and suffering at a high level. It's important for you to learn as much as you can about the way that vaccines work and about the risks and the tremendous benefits that vaccines carry. I encourage you to learn further and to look at trusted resources, for example, the World Health Organization and the Center for Disease Control, as these will be able to guide you in learning more about vaccines. Thanks. I hope you have a good day.